Hello everyone. So I'm Dominic Alder. For those that don't know me, I work in the Health Sciences TEL team with Jane and Mike. And as Jane has said, Paddy is on holiday this week. I think we'll let him off this one. So I'll be covering his sections in this presentation, which we initially gave at the BILT conference earlier in the year. And we're going to talk about a two-day sexual health workshop that is delivered as part of the Year 4 sexual health teaching. So pre-COVID and last year, this is how the sexual health teaching in Year 4 was structured. It's part of the reproductive health and care of the newborn unit, which is now known as a clerkship, and it's split across 3 different sections. There's some case-based teaching based at the medical school. There's a placement at the Unity Sexual Health Clinic, going through role-playing and history-taking, etc. And there's a third section which is more clinic-based, where the students get to shadow clinicians and health advisors, etc., and apply the role-playing that they undertook in the second part with actual patients. So that's how it was initially structured. And why is it important? Well, this is usually a section that Paddy covers, but research shows that there are multiple barriers to sexual history taking by clinicians, and certainly from what we've seen in the sessions that we've run so far, is that while students are familiar with taking a history from their work in Year 3, these kind of histories are very different. They are much more complex, and often the issues are not initially presented. It's very important to understand that, and this gives them a real opportunity and a real safe environment to understand how to take these histories effectively. So we had this nicely designed workshop, face-to-face workshop, split across face-to-face teaching and the clinical environment, and then COVID hit, and sorry, I just skipped on. And then COVID hit, and we were put in a position where we needed to try and deliver the essence of this teaching and the aims and objectives in an online environment, but also to think about how this could be delivered for the academic year that we're now in, which was the shift from within the medicine programme towards case-based learning. Really, the question that we needed to approach was how we can deliver this teaching online. Okay, and so this is the structure of what we came up with. So initially it was delivered to 65 students. So our students were split into 4 blocks last year. And within those 65 students that we took in this block, they were split into groups of 13. And so 13 students at a time took this 2-day workshop. And the first day was essentially a collection of recorded lectures supported with case-based learning activities with model answers that the students were expected to go through. There was an online quiz, interactive quiz built in an authoring tool called Xerti, which we can go into later if that's helpful. And there was also some additional reading around how to take an effective history and the kind of blueprint you should look at in terms of the structure of your questions. And that was quite important reading in preparation for day 2. And certainly in the session that we ran last week, it was very clear which students had and had not done the reading. So that freed up the second, so the first day was all asynchronous, and that freed up the second day to be a purely synchronous teaching session broken into smaller bite-sized pieces. So within that, there was a history-taking workshop in the morning, and this involved various role-play activities within student groups, which I'll go into in a little bit more detail. And then there were 2 case-based learning tutorials in the afternoon, all delivered by Collaborate, obviously the tool that we're using for the session today. So Paddy and his team have been involved with a an evaluation study of the students that have completed this revised workshop so far. So obviously we had the 65 students that completed it in the last block of the previous academic year. And I think so far we've had 13 students complete the workshop in year 4 of this year. And certainly the findings that they've gathered so far has shown that the workshop has really increased students' confidence in their ability to take a sexual history, to take a sexual health history. And certainly throughout that, there's been plenty of signs within the evaluation that they've done that this is the case. Okay, so moving on, so I can put these quotes in. They're all about Paddy, but it's okay because he's not here. Obviously, he's the main facilitator. The students really, from what I saw within the sessions moderated, the students really did seem to value the ability to practice this in a safe environment, just amongst themselves. And I think the move to the online delivery of this workshop really accentuated that. And that was certainly something that proved to be very popular within this. But also, I think Paddy's approach was, as it says there, encouraging, empathetic, open-minded. He was also very keen to let students find their feet in these sessions. He wasn't afraid of what people have referred to as the awkward silences. And certainly in the initial workshop, the first part of the workshop where people start to think about why patients may attend a sexual health clinic, how they may feel, and then go through the initial role plays. He was very happy for students to find their own feet and let those silences grow. And certainly they started to become smaller and smaller as the day went on. Okay, so compared to what went before, I think the overall strength was that certainly the feedback was very positive, and certainly students appeared to feel as confident doing it in this way as they had done previously face-to-face. They will have some additional teaching going forward where they can go out onto the boards and take histories face-to-face. And some of the weaknesses, well, some students have said that they do feel a little bit contradictory, unsure, because they haven't had that patient time, but that is coming for them. So that is part of a later part of the sexual health placement. Okay, so with these sessions, I and co-model so far. So I just wanted to give a bit of an insight into some of my experiences with running these sessions, and I'm sure these overlap with things that you've been told already, not just here, but in the digital design course and elsewhere across the university. Certainly, having a moderator to support each session, even with only 13 students, was really important. It freed up Paddy to concentrate on actually working with the students. And it left the moderator, and that was split between myself and other people in the curriculum team, to concentrate on things such as organising groups for the students to go into for the role play scenarios. So, excuse me. So the students would be split into groups of 3, and in each role play scenario, one of the students would play the patient, the other one would play the doctor, and the third student would be an observer, and then they'd rotate around across the different role plays. Now that did take some work from behind the scenes, particularly because the groups were fixed. So Paddy wanted, or the workshop needed, particular students to be in particular groups, and so the moderator had to arrange those groups each time the students broke out. And this is one of the slight weaknesses of Collaborate, I think, in that if you define your groups and you put students into those groups, when you bring them back, the groups reset. So you do have to, so if you have multiple breakout sessions within one session, you have to go back and rebuild the groups, which is a little bit frustrating. Obviously a full day, and it is quite intense. I think it was 3 to 3.5 hour sessions on the second day. It's quite intense, and it perhaps does go against some of the the other guidance that the university has provided, but we did take steps to ensure that this was as digestible as possible. First of all, it was very interactive. There was the group-based role-playing scenarios in the morning, and then there was the case-based learning discussion in the afternoon. So there was always something that students were doing. There really wasn't very much where they were just listening to the facilitator. And we also had regular breaks. So for every hour, there was a break where they could go away and get a drink and come back. And I think that certainly helped. Other things I noticed in my time as a co-moderator, the awkward silences that I mentioned before. The group work that the students did really, in pretty much every session I co-moderated so far, was a real turning point in student engagement. So in the initial section, where all the 13 students are working directly with Paddy, Paddy would play the role of a patient, and the students would come in and ask questions based on some of the reading that they'd done the previous day. There were a lot of awkward silences, etc., and it did take a while to get going. But once the students had a chance to try this out within their own groups of 3, and then they came back to the main group, we found that the students were much more willing to participate in the bigger group going forward. And so that really was quite a big turning point. And like I said, yeah, don't be afraid of silence. I think after a while, the students certainly knew what they had to do. So yeah, this really just reiterates one of the earlier slides. The feedback we've had has been very favourable so far, but it's important that this is not to state that this is not a replacement of the face-to-face elements of this this clerkship. The students will still get an opportunity to go and take a history from a real patient, and I think that's really the only piece that we couldn't perfectly replicate by delivering this online, and that is coming forward for the students in due course. I guess it goes without saying that this, particularly the second day, does take quite a lot of work from the staff side. So for each session, there was Paddy as the lead facilitator, and at least one other tutor going in particularly for the group work. So the other tutors would go in as facilitators and move between the groups during the role play activities. And then I think after a few times when that tutor was comfortable with leading the workshop, they would go on and run the workshops and going forward, because obviously there are quite a lot of them. But that's perhaps the flip side of this, of having a fairly sort of complex structure with the group work, but also with the level of interactivity, particularly in the second day. It did take a fair amount of staff from behind the scenes to make it work. Okay, and there's just the people involved. So there are the tutors on the left, alongside Paddy, and the staff from within our curriculum team in the right, who were involved with setting up 2-day work.